Venous thromboembolism, or VTE, is a combined term for deep venous thrombosis, or DVT, and pulmonary embolism, PE. It's one of the most common complications for our patients in the ICU and causes approximately 200,000 deaths per year in the United States. DVT has been considered a quality metric mainly because many in-hospital DVT or PE events and the subsequent sequelae are considered preventable with appropriate prophylaxis. Most hospitalized patients over the age of 18 have at least one risk factor for VTE, and most surgical patients are considered moderate or high risk for VTE. Many large, dependable clinical trials have proven the benefit of thromboprophylaxis for prevention of VTE. In order to assist our providers to do the right thing for our patients, the St. John Providence Health System VTE subgroup utilized clinical decision support and reconstructed order sets in such a way that risk assessment and appropriate prophylaxis or a contraindication reason for not ordering prophylaxis must be completed in order to continue placing order on their patients. This subgroup chose to use the Caprini assessment as a guide to determine risk stratification and appropriate treatment based on that level of risk, ensuring that patients receive the appropriate care and that providers have a tool to assess risk stratification. The first scenario is a 46-year-old female patient with a BMI of 35, varicose veins, and a history of congestive heart failure who has been admitted to the med-surg floor with pneumonia. You want to order blood work. Order a CBC for your patient. In the process of ordering your blood work, because a patient has not received an order for VTE prophylaxis or a contraindication, an alert will fire. As part of the alert being fired, the alert displays pertinent patient information, and the most recent lab results will display in the left portion of the window. You'll notice that the Caprini scoring information, which helps you assess stratification of risk for DVT, displays in the bottom of the window. Based on Caprini's score risk factors, this patient has several risk factors: an age greater than 40, a female sex, BMI greater than 25, varicose veins, congestive heart failure, and pneumonia. This patient is defined as high risk based on a score of 5 or more Caprini points. For this patient, the power plan option would be VTE, DVT, medical, high risk. The emergency bypass option is available and is to be used only when the situation is an emergency and there is not sufficient time to enter VTE orders. Use of this option will be monitored. Select the High VTE Risk tab. For this patient, you would select High VTE Risk, the High VTE Risk tab, right? Okay. When the subphase displays, you will notice that the evidence-based choice of heparin is already pre-selected. If heparin is contraindicated and enoxaparin or Lovenox is required, you may deselect heparin and choose the appropriate dosage of Lovenox. Another scenario would be a post-op patient. Your patient comes to the emergency room with right lower quadrant pain, was examined, and it was determined that the patient required emergency surgery. The patient was taken directly to surgery. The patient's surgery is complete and the patient is now in PACU. The post-op orders for the patient must now be entered. The find field, type surge. In this case, a generic post-op plan was chosen. Because the filter is set to starts with, all of the orders and power plans that start with the word surge now display. If you currently have surgical power plans saved in your favorites, you will need to select an appropriate power plan, make your modifications, and save as your new favorite. You will accept the pre-selected orders. If you do not complete your VTE orders or complete a contraindication order, when completing your post-op power plan, a VTE alert will fire. In the left portion of the window, the alert displays pertinent patient information and most recent lab results, if this information has been documented. You'll also notice that the Caprini scoring information displays in the bottom of the window. To place the order for VTE prophylaxis, from the alert that displays, you can choose to return to the power plan to place your VTE orders, or you can select an appropriate contraindication order to complete the alert. The VTE subphase has been recently modified in all power plans and resides in its own subcategory. You are unsure of the risk stratification for your patient. You want to view the Caprini scale to determine the risk for your patient. To view the Caprini assessment tool, if needed, click on the Internal Evidence link. When the risk assessment has been determined, you can choose either moderate or high risk. Because our patient's score was greater than 5, we determined that our patient is stratified as high risk. When you select the appropriate subphase, VTE, DVT, prophylaxis, general surgery, high risk, in this example, the plan will populate. Notice the evidence-based choices are already pre-selected. If heparin is contraindicated, deselect heparin and select the appropriate enoxaparin dose. When you have completed your orders, return to the Surge Generic Post-Op Power Plan. Notice that there is also an option to order a subphase for heparin-induced thrombocytopenia, or HIT, for those patients with a previous history. When you are ready to sign your orders, if you want to initiate the plan immediately, select the Initiate button and then the Orders for Signature button. Clicking only the Orders for Signature button will place your orders in a planned state. When orders are signed and put into the planned state, nursing associates will initiate the orders at the appropriate time. St. John Providence Health System leadership believes that implementing this mandatory process will ensure that patients are stratified by risk and appropriate VTE prophylaxis will be ordered for our patients as soon as possible after their admission to the hospital. This clinical decision support strategy will not only provide improved patient care for our patients, but also help our institutions achieve value-based purchasing dollars from CMS and Blue Cross Blue Shield through compliance of our core measures.